And she's now 63 years old lady, and she has a history of falling down in stairs. And that accident took place 2.5 weeks ago. So she was taken to the emergency room, and there she was x-rayed, and her x-ray showed cervical dislocation or subluxation in C5, C6 level. So could you first explain me where are you experiencing most of your pain?
It's here in my fingers and hand, both hands like this. And
how far up your pain is extending? Where is the limit of your or level of your pain?
It's here is
up to that level.
Yeah.
So here you are still feeling some abnormal sensation or
but
pain.
the wrist is okay.
Wrist is okay at the moment, right? Is it the same thing with your left arm as well?
Yeah, here is.
Whereas the upper limit is around here. How does your pain feel like?
It's like stinging.
Stinging pain?
Yeah, like needles.
Like needles and pins, right?
Yeah.
So why are you keeping these mufflers in your arms?
Because after 12 o'clock p.m. It's like ice.
Ice cold?
Yes.
Feels like ice cold?
Yeah, they are like in ice box.
Right. So if they feel abnormally cold, even though it's warm here inside right now at the moment. How about, do you have any burning sensation in your fingers, like they would be in fire at the moment? You're talking about ice cold feeling, but is there also
in the morning
hot feeling? In the morning?
In the morning, yeah, before I get my medicine.
Okay, right. So it's the early morning burning pain, and then it kind of changes to the ice cold feeling and continues until the evening. Okay, I think this is okay about your history now. So we have very recent trauma, less than 3 weeks old, and burning, stinging, pins and needles, and also feelings of cold, abnormal ice cold in arms. And now we are going to make a neurological examination. We start the clinical examination. I'm not going to examine the cranial nerves today because she has not any complaints in her head or face, and also she didn't experience any head trauma in real sense. So we concentrate first to the upper arms, and first I'm going to examine the muscle tone to find out if there is any spasticity or rigidity. So keep your arm relaxed. I'm going to move it back and forth like this, and then the wrist also. And then I ask you to extend your arms like this, and then take them to your side, and then push up all the way like this, and cross your fingers here and take them down, and then back in front of you, and then down. Okay, we can see that the elbow movements are perfectly normal. There is no limitation of these upper extremities movement. Then would you please extend your arms again to this position. Now I'm going to examine the strength of your upper arms. Now I'm going to push this down and ask you to resist. Good. And then this other arm. Good. This seems to be perfectly normal strength. Then I'm going to examine the arm flexion. Pull this towards your face. Yes, and this one. Now. Slightly weaker, not much, but this is almost close to normal, and there is slight weakness in this arm. And now I'm going to examine the elbow extension. So I support your right elbow and take your wrist into my hand, and now I ask you to push it down towards my hands, and I'm going to resist again. So push it down towards my hand. I'm going to lift it up. Yes, also the extension is very good here. Thumb and little finger, do they find their tips together? Yes, this goes very well. There is a gap between the nail of the thumb and nail of the little finger. But if she tries, she can find the ends to meet. But it takes extra strength.
No.
Now it goes. Yes.
Really.
What about here? Can you make the ends meet? Thumb and small finger, thumb and little finger.
It's easier.
Yeah. Or again, could you extend your fingers and then put them back again? And then keep your hand straight here. And I'm going to push your hand down. Try to keep it like in this position. Here we can find out that also the extensors of the fingers are not doing properly. Let's make a fist first, so that do they find... Yes, here we can see that she can make a fist with all her strength, but the little finger, there is a small gap there, but if she tries and tries, she can make it so that the end of the small finger finds also the skin of the hand. Good. First I'm going to examine the biceps reflex, and I ask you to keep your hand in flexed position, and then I put my finger here to the elbow and hit with the reflex hammer my own finger and see if the movement takes place. Yes, the proper movement is taking place, so C5 root is functioning normally here. Then I examine the triceps reflex, TRI, triceps reflex, which is examining the function of C7 root. And here I try to hit with my hammer the tendon head of the triceps muscle. And here we find out that no movement is taking place, so this reflex is absent. And the third one I examine is the brachioradialis reflex. Some call it also supinator reflex, but brachioradial reflex is a better name for it. So here I put my forefinger to the bony radial prominence of the arm and hit my finger, and here we can see the proper flexing movement of the arm. So brachioradial reflex is functioning normally here. So thermal allodynia can be tested with both cold and hot objects, and you can make a cold object if you keep this metal object under the running cold water for a while. Then you dry it up. Now this should be quite cold to your skin. Can you feel this cold object here? Does it feel cold?
Yes.
Is it any unpleasant sensation here? No. And what about
cold.
Just cold? What about here? Do you feel the cold here?
It's cold.
Here? What about here? Do you feel cold or unpleasantness?
Cold.
Here?
Cold.
Okay, then we take the fingers. What about little finger? How does this feel?
I don't know.
Does it feel anything?
Just some that you put something.
Okay.
there.
What about here?
It's cold.
It's cold.
Yeah.
Does this feel any unpleasant?
Yes.
Yes.
Yes, it's unpleasant.
What
But
about
cold?
this side?
I don't know what it is.
Yeah. You don't feel any coldness here.
Yeah, but unpleasantness.
Do you feel unpleasant?
No, that. But
Here, here you can feel unpleasant. So this cold, it doesn't feel cold, but it feels unpleasant. Yeah. And here, this side as well.
Yes.
What about here?
It's cold.
It's cold only.
Yeah.
So there is also slight cold allodynia in her little finger here. I'm going to fill up this tube with hot running water, and then I examine hot sensation. This is very rude test, of course, but can do very well in bedside examination. So do you feel hot here?
Yes.
What about here?
Yes.
This feels hot. Here?
Yes, it's hot.
Is this unpleasant or just hot?
It's hot.
Yeah. Here?
Yeah.
Here?
Yes, it's hot.
Then we take another way. Do you feel here hot?
Yes.
Here?
Yes.
Here?
Yes.
What about here?
I don't know what it is.
You don't feel here?
Yeah.
Okay, what about here?
No. It's just the press.
Just the pressure, so
Yeah.
you don't feel heat here at all?
No.
Okay, there is a loss of heat sensation in this fourth and fifth finger. What about here? Do you feel
Yes.
hot here?
Yes.
So it's only limited to these tips of this fourth and fifth finger, this loss of heat sensation. What about here? Do you feel anything?
No, just
Here?
press. A little
Little
hotness,
heat.
yeah.
Yes. Here?
Yeah, a little.
Here?
Yes, it's very, yeah, it's hot.
It's hot here,
Yeah.
right. So there is reduced heat sensation in fourth and fifth fingers, but not allodynia actually. And first now I'm going to do this one. Do you feel this here?
Yes,
What about here?
yes,
Here?
yes,
Here?
yes,
Do you feel here?
yes,
Here?
yes,
Then what about the thumb? Do you feel here?
yeah,
Do you feel the tip of the thumb?
yeah,
Here?
yes,
Here?
yes,
Here?
yes,
Here?
yes,
Here?
yes.
Here?
Uh-huh.
Oh no, what
No,
was
it's,
that?
pain.
That was painful.
Yeah,
So when I
yeah.
touch the tip
Yeah,
of your
mm.
fourth finger, that feels painful.
Yeah,
What about here?
it's. I feel it, but no pain.
No pain. Do you feel
Yeah.
this touch at all?
Yes,
Yes.
yes.
Is there difference between these fingers?
It's stronger here.
Which one is stronger?
The little.
Little finger is
Yes,
stronger.
yes.
Yeah. But this feels
Oh.
painful. Yeah. Okay.
Yes,
But not here.
not here.
Okay. So
Yeah.
here we can find out that touching her tip of her fourth finger only is painful. What about dynamic allodynia here? Do you feel this painful?
Yeah, no, painful.
Here?
It's okay.
It's okay, you can feel the movement,
Yeah.
but it's not painful.
Yeah,
What about here?
it's the same.
Same, normal. What about here?
It's painful.
It's painful.
Yeah.
So you feel the movement also painful.
Yes.
What about here in the lower part of the finger?
No,
This okay.
It's just movement.
Yes. But this feels painful.
Yes.
Okay. What about small finger? If I move it like this, does this feel painful?
No.
No. So here is dynamic allodynia. But there seem to be also compression allodynia. Let's take it once more. So do you feel this painful if I press here?
No.
What about here? Yes, this feels painful
Yes.
here. What about here?
A little.
Little bit.
Yeah.
Here?
No.
No. So the slight compression allodynia on the tip of the third finger and prominent compression allodynia on the tip of the fourth finger, as well as dynamic allodynia here as well. And one more thing is to examine the pinprick sensation. So here we can find some sharp object like this tooth stick. Do you feel sharp here?
Yes.
What about here? Is the same kind like here on this side? Is there any difference?
Yes, it's not so sharp.
Okay, so it's less sharp here
Yeah.
on this side
Yes.
than here.
Yes.
Okay.
I can
So-
feel it, but it's not so sharp.
Yeah, so you can feel the sharpness, but there is still the difference.
Yeah.
Okay, now I examine a little bit of your movement here. So just first walk around here, just normally to the door and back here. Just want to look a little bit of your gait. How do you feel like when you are walking? Do you feel unstable or stable?
Oh, I feel stable.
You feel stable. Do you
Yes.
feel like that's your normal way to walk? What you do?
It's a little bit more unstable than normally.
Than normal,
Yeah.
but you can, however, walk.
Yeah.
Then could you walk with your toes? Okay, that goes well. And to the door as well. And then back to the chair. And then could you walk with your heels? Here to the door.
Like this.
Like that, yes. And then turn again back. Good. So she can walk perfectly well both on her heels and on her toes. And then put your legs together so that your heels meet and your big toes meet, and then extend your arms like that, and then close your eyes. This is the Romberg's test, and you should stand there a little while. Here we are examining how she's able to keep her balance. Like you can see, there's a little bit swaying movement, but she can, however, keep her balance normally. Then I examine a little bit the strength of your lower leg. So could you go down on your knees and then back a couple of times like this. Come a little bit forward here. Yeah. Now go down on your knees and then up and then down again and up and down and up. Yes, you can do that also perfectly well. So there is not much strength disorder on her lower legs. Okay, then I make the examination of the patellar reflexes by hitting here the tendon, and we can see the normal movement here. It's not exaggerated, it's functioning perfectly normal. It's not also expanded because here we can't elicit any reflex. What about the left leg? No movement here, so it's not expanded, but here we can find the normal reflex movement. In some patients with spinal cord injury, they may have a patellar clonus, which you can examine by putting your hand flat here and making this kind of sudden movements. If there would be clonus, this leg would start to go like this. But here we can't find any abnormal movement, so there is no patellar clonus present here. Then we make the examination of the Achilles reflexes. I take the leg here and then hit with the shaft of the reflex hammer to the Achilles tendon. And here we can find the proper movement also. This is the normal movement, not any exaggerated movement, but normal Achilles reflex. And then also the left leg, again I hit with the shaft of this hammer to the Achilles tendon like this, and we can see the normal Achilles reflex movement taking place. And clonus of the Achilles, possible Achilles clonus, is examined like this, that we make the sudden movement, sudden flexing movement of the ankle, and if there would be clonus, it would start going automatically for a while like this, but here we can't find any abnormal movement. And also here the Achilles movements are normal, there is not any clonus available. Not any clonus present here. And then lastly we can do also the Babinski sign. For example, with this sharp end we make a little tickling movement of the heel and sole of the foot, and it goes down like it should go. What about this one? Also this upper toe is going down, which is a normal sign. Simple way also to test the position sense, which you should also do for all the pain patient, is to examine it from the toe. So I ask you to close your eyes, and then I'm going to move your second toe downwards and upwards, and I ask you to tell which way is it going. So is it now going down or up?
Down.
What about now?
Up.
Now?
Down.
Good. Now we have made the clinical examination and also taken the history here. So there was a dislocation or subluxation on C5, C6 level, but here in the examination we found also neurological symptoms and signs from C7 and C8 level. Especially the most painful areas came from C8 level. So she had allodynia, hyperesthesia and hyperalgesia on her ulnar fingers, which is innervated by C8 root level. But this is not unusual in this kind of injuries. So what would you say now about your medication? How you feel? Has there been any help of your medication when it has been started?
Yes, very much.
So what we have found here after starting the medication, the painful area has decreased in size a lot, and also the abnormal sensation have improved. So there is not any more constant burning sensation in her upper arms, and the area of pain has reduced prominently. So thank you very much, and I hope all the best. I think you will be in much more better condition after next 1 or 2 months.
I hope the same.
Thank you.
Thank you.